My name is Mohammed Wasim. I'm
There
a
you go.
pediatric emergency
It
physician at
works.
Lincoln Medical
Thank you.
Center in the Bronx, New York. And today we are going to talk about ethical issues in research involving children. I do not have any disclosures associated with any products or devices discussed in this presentation. The objective of this talk is to discuss the basic ethical framework to conduct the research responsibly, especially in children. We highlight some ethical principles and discuss the autonomy and issues regarding informed consent in pediatric research. We'll describe the confidentiality issues in research, particularly for adolescent population, and then finally discuss the issue related to the payment in research. Hungry Children Nutrition Experiment. In this project, children were deliberately starved as a part of an experiment investigating the value of vitamin. This was conducted during 1940 and this was a government nutritional experiment. This project continued from 1942 to 1952. And similar unethical research was conducted in many other vulnerable populations such as prisoners, minorities, soldiers, etc. Willowbrook study. This was conducted at the Willowbrook State School in Staten Island, New York. In this center, developmentally disabled children were housed. Children were intentionally infected with hepatitis virus by feeding them a solution which contained the feces obtained from children who are infected with hepatitis. And the parents were told that their child would not be cared for at Willowbrook unless they participate in this study. So there is a huge concern about the voluntary participation of the subject. And this is a consent that we are studying the possibility of preventing epidemics of hepatitis on a new principle. Virus is introduced and gamma globulin given later to some so that either no attack or only a mild attack of hepatitis is expected. There is a claim in this that we should like to give your child this new form of prevention. So there is a promise and there is a new claim in this consent form. This justification was given for deliberate inoculation of hepatitis virus because there was a high rate of infection at that center. So it was practically inevitable that every child will become infected sooner or later. The monster study, in which many of the normal speaking orphan children who received negative therapy in the experiment suffered negative psychological effect. This is the negative reinforcement statement. You have many of the symptoms of a child who is beginning to stutter. You must try to stop yourself immediately. Do not ever speak unless you can do it right. And some of these children develop speech problem for rest of their lives. So human subject research is a privilege. It is not a right. It is based on trust. One must ensure that the rights and welfare of the subjects are protected, and the research should be conducted in compliance with the federal regulation and local regulations. So, why include children in research? Children are different. They are not a small adult. They handle matter differently. Their issues are different from adult. Children develop differently. When you talk about children, you think about in weight dependent milligram per kilogram context. Certain medications have side effect which occurs only in children, and many problems are only applied to children. So this is a moral obligation that the research should be conducted when there is a scientific necessity. Children should not be enrolled in a research unless it is necessary. there must be a genuine uncertainty or clinical equipoise about whether one intervention or treatment is better than the other. There is a critical need for pediatric research that underscore the responsibility to ensure that children are enrolled in a clinical research that is both scientifically necessary and ethically sound. What happens if children are not included? Slows or even halts scientific progress. We will not have any pediatric data. There will not be any age dependent safety or efficacy data. And we assume if it has work in adult, it should work in children. And there may be possible harm for providing untested therapies that are assumed to be safe and effective based on adult data. So, this is an ethical imperative that children should not be unfairly excluded from the benefit of research. Research provides benefits, but one should not be unfairly excluded from the benefit of research, and children should be protected from the risk of medical research. And both these approaches are in conflict. Do no harm. This is the important principle. This maximizes benefit and minimizes harm. Right actions and practices that result in the greatest welfare for greatest number of people. One must clarify what would happen without the research and assess relative risk and benefit. So when you perform the research, one always assess benefit versus risk. If the risk is higher, one cannot perform the risk. There must be higher benefit than the risk. Practice versus research. The Belmont report defines and delineates the difference between the practice and research. The practice refers to interventions that are designed exclusively to enhance the well-being of an individual or participant, while research promotes the scientific knowledge. One always make a balance when doing a research, whether there is a higher risk or higher benefit. Justice is fairness in distribution. There must be equitable distribution of burden of research. Research has risk. Research procedures have risk. One must understand this. There must be equitable distribution of burden. One population should not bear the burden. This allows research benefit to be available to every population. And this is called distributive justice. That high quality health care is available to every population, including the vulnerable population. Every individual is considered autonomous. Their opinion, their choices must be respected. Many populations may have diminished autonomy, such as children, and they should be entitled to protection. As the vulnerability increases, there should be more layers of protection. That's why we have a requirement for informed consent. It means that all the participants should enter research voluntarily and they have adequate information, and this also supports the developing autonomy in children. Principle of respect for person applies to consent process. Consent is a process. It is not just one time encounter and getting signature. It is a process in which all important informations are shared and making sure the participant understand the risk and benefit. Children are vulnerable. They have a dependent status. They are subject to the authority of others in making decisions. They have limited ability to understand and make decisions, and they have limited capacity to understand the risks and cannot make adequate assessment of the risk-benefit relationship. There are regulations that safeguard children's rights, and all the research should be according to these regulations. And there is an institutional review board that making sure the, the participant rights are protected. These are the elements of consent. Getting informed consent, however, does not rule out exploitation. So these are the elements that one must always abide by. Making sure there is no coercion, making sure there is a disclosure and adequate informations are provided, and it should be written in a way that person can understand. It is the responsibility of the researcher to make assessment whether the participant have the ability to understand the option and they have the ability to understand the consequences of actions. Assent is a child agreement to participate in research, making sure that they have a developmentally appropriate understanding. Disclosure of nature of proposed intervention, what it involves, for example, is blood draw or any other intervention that has to be disclosed at that meeting or encounter. Assessment of child understanding of information provided is the responsibility of the researcher. Privacy and confidentiality. The privacy is about the people. Confidentiality is about the data. Sensitive information should be kept secret and confidential. Asking teens, for example, about their sexual behavior, use of contraceptive, sexual transmitted disease, pregnancy, and etc. All this sensitive information must be confidential and must be secret. However, it is important to disclose that if the teen disclose something that would suggest they are not safe, then the researcher would need to take a step to make sure they are safe. Providing confidentiality lies within the limits of legal requirements. Invasion of privacy, disclosing sensitive information to the parent that adolescent does not want to share. One cannot share their sensitive information. Their private action should remain private. Now we talk about the payment to the research participant or parent. Money, incentive, they all can distort their decision making and then may have problem with the child welfare. The amount that is given should be fair and reasonable. It is a compensation for their participation. It is not a payment. It is a compensation for their participation. The clinical relationship, for example, pediatrician and patient and the child relationship, that can also cause undue coercion for participation. Parents cannot say no, have difficulty in saying no when their pediatrician become a researcher and enrolling children for research. Undue influence. Children are more prone to being unduly influenced and similarly are unprivileged or impoverished populations or disadvantaged population. They are more prone to being unduly influenced by the financial reward. However, the payments needs to be identified as a reimbursement for the time and transportation, and it should not be excessive that can unduly influence and coerce them. In conclusion, ethical principles of research are not the same as those for clinical care. We need to do research on kids to know how best to treat them. Finding the right balance between the risk and benefit is important, It is also important to provide protection to the minor, to making sure their rights are protected. Careful consideration of the scientific context, evaluation of risk and benefit, and protection to participant is required. Thank you.
Are there questions from the audience? If so, please put them into the chat box. Okay, I'm not hearing any questions, but Dr. Wasim, could you comment on the role of the IRB in protecting children?
So thank you. The IRB is responsible to making sure the rights and welfare of participants are protected. So they evaluate the protocol and determine the context where the children are enrolled, how the consent will be obtained, uh, what data will be collected, is there any payment involved, and making sure this how is going to be given to the parents, and whether it's excessive or not. So these are all considerations. So purpose is to making sure the rights of subjects, meaning children, are protected and they are not unduly influenced by the other factors such as money, and making sure their rights are protected and they are not they do not every research have some procedures which may have some risk. So making sure that those risks are minimized.
And what happens if a researcher chooses not to present a protocol to the IRB, but just starts gathering data? Are there any consequences?
I mean, all every research in which human participation is involved, it has to go through the IRB. One cannot collect data and do the research without a review from the institutional review board.
Furthermore, there are severe penalties attached to not going through an IRB. Most research that doesn't have IRB approval cannot be published. If a researcher is found conducting research without IRB approval, other than the most superficial from publicly available databases, that researcher may be banned from any sort of funding for the rest of his or her life. So there are some teeth behind those regulations.
Right.
And are there any other questions from the audience at this point, or points of discussion? We invite you to speak. Hearing none, and we have only a few more minutes. Perhaps it's time to move on to our next presentation. Dr. Mohammed, that was a very interesting presentation, and I learned several things from it. I knew about the Willowbrook studies, but I was unaware of the starvation of the native children, the Aboriginal children. Do you happen to remember which Aboriginal children was it that were being starved?
It was a government-funded studies. I believe it was in Canada, but that's the only information I have.
I see. I work with the Navajo, and their children were abducted and kept for up to 12 years in government schools, forbidden to speak their native language, and with deliberate intent to erase the Indian in them while keeping alive the person. I don't recall hearing anything about unethical experiments, but such things are not always promulgated by the government. But I haven't heard anything among the local people's legends either. Well, so it's time for us to move on. Yes?
Thank you. So bottom line is we make sure that we need research for children, but we make sure that we follow all the rules and regulation, and we follow the basic ethical principles when we involve children in research.
Indeed. And it was almost too bad that they didn't have children in the first phase of the COVID vaccine studies.
Yeah. So if we don't have research in children, we will not have any data, safety data, efficacy data for children. So if you look at many medications, in every medication you'll see that there is a note that is not tested in children. So we don't have efficacy or safety data for many medications in children.
Exactly. Well, thank you so much for this enlightening didactic. I'm looking
Thank
forward
you.
to seeing you again next year.
Thank you so much.
Bye. Well then, your screen is no longer being shared. Charles, let's shut it off.